Thanksgiving happened, so now we're back. These videos are all about outcome. All about what happens when you get a very specific type of treatment. So, if you have sciatica, this video is for you. Because we have a solution and we want to help you better understand our solution. Part of why we do these videos is because most patients don't have a good understanding about what treatment is best for their back problem or sciatica. We treat a lot of sciatica. So our goal is to give you transparency, help you better understand what patients' conditions are like when they start our treatment and what conditions the patients are when they're done with treatment, which is outcome. How much better are you? And the reason we do this is because providers do not have to publish outcomes. Meaning when you go see your doctor, he's not obligated to publish what happens as a result of the treatment. It's just kind of confusing. And it's because they don't have to publish that patients don't understand what's best. Patient-reported data, which is pain and disability, which we'll talk about that in a minute, is what helps you make the best decision. So we use the Oswestry and we use pain. That's patient-reported data. Our goal is to help you make better decisions. That's the key. Patient-reported data helps you make better decisions. When you know what the outcome of very specific types of treatments are for your condition, you make better decisions about what your condition needs. Pretty straightforward, really. So, this week is this day is patient study number 15. 61-year-old male. Had back pain for 30 years. Okay? So this isn't, I just woke up this morning with back pain. This is, I woke up 30 years ago with back pain and I still have it. So he had back pain for a long time. Long history of back pain. And he'd seen several other doctors for this condition. Had an x-ray, although uniquely never had an MRI, which is interesting because the MRI really helps you better understand the source of your problem. Never had the MRI. Before seeing us, this patient had physical therapy, non-steroidal anti-inflammatories, had tried chiropractic and massage therapy, pretty traditional course of care for a back problem. He had back pain and leg pain, sciatica. Had it for a long time, a lot of things going on there, and had failed these therapies. And when I say failed these therapies, what that means is you tried these therapies and did not get any better. Came to see us. It's not uncommon that patients try other therapies and then they end up coming to see us. And the reason they come to see us is because of our outcomes. When other treatments have failed, we have the ability to help these patients. That's why this is so very important that you understand this. Patient had these therapies, didn't get better, came to see us. Now, if you have sciatica, we have a 9-step process to help you eliminate your sciatica. It's called the 9-step sciatica solution. One of the steps is education. This is part of it right here. So when you understand this, you're getting better educated. This is important, again, because it helps you make better decisions. So one of our steps is education. You're getting now. Another one of our steps is identifying the source of the sciatica. There are 5 main reasons you can have sciatica. We do a very, very, very specific type of MRI. It's not traditional, it's more advanced. It's called a 3D MRI. And with the 3D MRI, we're able to exactly pinpoint the source of your sciatica. And from that, then, we can pinpoint exactly how to treat your sciatica. There are 5 reasons. This patient had 2 of them. Had a degenerated disc and had stenosis. Now, these types of conditions, degenerated discs and stenosis, are typically the result of having the pain for a long period of time. We know the patient had 30 years of back pain. That's a long time. Okay? Degenerated disc stenosis causing the sciatica. When he started our program, our 9-step process, his back pain and his leg pain were a 10. Now, back pain is scaled from 0 to 10. 0 means I don't have any pain. 10 is I can hardly take it. It's pretty severe, can't handle this much longer. So when he came in, he was in a lot of pain. His Oswestry was a 60. Now, the Oswestry Disability Index is what we call the gold standard. Gold standard means it's used by everybody, and it's a very good predictor and evaluator for disability. Disability means my back pain affects me so it's hard to walk, it's hard to sit, it's hard to drive my car, it's hard to do my social activities. Now, this is a 10-question questionnaire that we score, and the score is from 0 to 100. And there are 5 categories within that score. 0 is no disability, I feel fine, I can do all my everyday activities without any pain at all. And 100 is I can't get out of bed. It's severe pain. So typically 0 to 19 is minimal disability, 20 to 39 is moderate, 40 to 59 is severe, 60 to 79 is crippled, 80 to 100 is bedridden. So he had a 60. 60 is crippled, meaning the back pain is so severe that he can't do his normal activities. Can barely get through the day. Okay, a lot of pain. Okay, high end on the spectrum. Went through the program, identified what was wrong using our MRI system. Identified what was wrong, went through the program. At the end of care, and I don't have this on here, but I have the sheet right here. He had 40 treatments. So at the end of 40 treatments, his back pain was a 0, his leg pain was a 0, and most importantly, his Oswestry was a 2. Everything we do is without drugs or surgery. Our goal is to help you make better decisions. If you have sciatica and you're not getting better, and you think your only option is surgery, you can come see us. Now, the one thing that we know is typically patients that have an Oswestry of 40 and above for an extended period of time end up having surgery. And in his case, he was a 60. He was pretty high. Came in to see us thinking the only option he had was surgery. He got better. So what is outcome? Outcome is his pain was a 10. We got it down to a 0. So he was 10 points better. We were able to eliminate his pain by 10 points. We got him from 10 down to a 0. Pretty straightforward. His Oswestry was a 60. We got it down to a 2. So, in his case, that was 58 ODI better. ODI better. Okay? So when you evaluate outcome, what we look at is how much better is the pain and how much better is the Oswestry. This is how you know outcome. This is the benefit of our treatment. This is the overall outcome. So, last time I did this, which was before Thanksgiving, and I didn't know how to run the camera myself, and Cody wasn't here, so we didn't do it. I had a study that we were going to go over about outcomes, and it was a study for surgery. So tomorrow, we're going to go over this study. Tomorrow we're going to go over the study, and I think Thursday we're going to talk about a testimonial where we have a video attached to the numbers so you can see what the patient looks like and talks, things like that. So, but tomorrow we're going to go over the study because I want to show you what these numbers look like Okay? What is the change that takes place as a result of surgery for a similar condition? That's the key. What happens when you have this problem and you get therapy? If you get these therapies, we know in this case, patient did not get any better. Okay? Came into our program, got better. It's very common. It's very common because we have a solution for these problems. If you have a degenerated disc, even if you don't have sciatica, if you've got back pain from a degenerated disc or stenosis, we can help you. So this is not just about the sciatica patient, it's about patients that have back pain as a result of these problems. That's what we treat. I'm going to talk to you about outcome tomorrow, and we're going to compare what we do to what they do. Because we're going to compare it by using numbers. It's the metrics. It's the metrics of the outcome. That's outcome. Okay, why do we do it? We help you better understand your problem. We help you better understand what can be done. Okay? Providers do not have to publish outcomes. They do not have to publish outcomes. Okay? Because of that, you do not know what to expect by getting certain services. This helps you better understand. We want you to know. We want you to make better decisions. It's pretty straightforward. When you understand this, you make better decisions. When you make better decisions, you have less bouncing around the system. Chronic back pain is on the rise. Why is it on the rise? Because people aren't getting the best treatments. Our goal is to help you eliminate your sciatica and your back pain and get the best possible treatment. That's it for today. Tomorrow we're doing the study. Thursday we're doing the testimonial. Have a good day. If you need us, click a link, call us. We'll put the phone number in there. Thank you.